And we're live, Chair Moffat.
Thank you very much. I will call to order the December 15th meeting of the Community Safety and Wellbeing Plan, and I will ask for a roll call, please.
Chair Moffat.
I'm here.
Warden Danielson.
I'm here.
Councillor Roberts will be with us soon. Councillor Burton.
Here.
And Councillor DeVolen.
Here also.
Thank you.
Thanks. May I have a mover and a seconder to adopt the agenda? Councillor DeVolen, Deputy Mayor Danielson, sorry, Deputy, wrong table. Warden Danielson.
Moved by Councillor DeVolen, seconded by Warden Danielson. Be it resolved that Haliburton County Community Safety and Wellbeing Plan Steering Committee agenda be approved.
All in favor? That's carried. Thank you. Any disclosures of pecuniary interest today? Seeing none. Do we have minutes from the previous meeting? I don't know that we do.
I think the notes were circulated by Strategy Corp later, so we're not really addressing in the same way. Sorry.
Right, they're not. All right, well, the new business is the business arising. So we will bring in the Strategy Corp folks and let them do their thing.
All right. Okay, great. I've been promoted to panelist, so we can get started.
Yeah, I'll just turn it over to you to take it away for us. Thanks.
Awesome. All right. Well, thank you all for joining us today. It's been a little while since our last meeting. I'm going to share my screen so we can jump into our presentation. Just as a refresher, my name is Lauren Wyman. I'm a director at Strategy Corp in the management consulting practice. And I'm joined today by our principal, John Matheson, and we also have our senior advisor, Matt Turigian, with us today. Just to give a little bit of an overview of what we're speaking about today, we've got a bit of a progress update. It has been a little while since we last spoke to you. Then we're going to go into a bit more of the details of the actual community safety and well-being plan that we have drafted for your review and circulated about 2 weeks ago. And then we will take a look at next steps. And in that big 60-minute chunk there in the middle, there will be time for reactions, questions, a little bit of discussion as we go through kind of each priority area. Sound good? Okay. So by way of update, at our last meeting, we aligned on a draft CSWB framework with this group. So it was kind of a high level overview of the priority areas that were emerging and some of the key enablers, as well as some of the risk factors that we would need to be aware of. And since then, we've been pretty busy. Strategy Corp developed and circulated an annotated draft outline in conjunction and co-designed with the advisory table. We worked with the advisory table in one-on-one interviews to kind of go through each page of the plan and make sure that everything was being characterized correctly. As a reminder to the steering committee, the advisory table represents the county through Mayor Moffat and Mike Rutter, as well as the OPP, HHS, Haliburton Highlands Secondary School, Point in Time, the Haliburton Kawartha Pine Ridge Public Health Unit, CMHA, and the City of Kawartha Lakes. In addition to those stakeholders, we also gathered feedback from a member of the Roundtable for Ending Poverty, just to get that angle and feedback on the report as well. And so then after another validation session with the advisory table, Strategy Corp developed a final draft of the plan, which is the version that was circulated to you all. And a community survey was also conducted in conjunction with members of the Haliburton County Service Provider Network. And they represent about 30 plus of the service providers. And so in doing that work with them, you know, we had a couple sessions and a couple different feedback loops as we designed the survey. And we were really happy with the response rate. We got just over 100 responses. Yeah, so that's really all of the different activities that have been going on as we draft this plan, really trying very hard to include as many people as possible. The surveys were provided. We mailed some hard copies out to a number of service providers who said that they had clients that would like to fill them out, and we collected them in hard copy and analyzed them all. So those have been input. We also tried to make as much as possible, given the limitations with any of the public consultation that we did. So we had one public consultation session, as much as possible, tried to make it easy for those who might not have access to computers or internet at home by working with the library. So that was an option that nobody ended up using, but we did feel that it was important to make sure that that was offered up. Any questions on this slide or any of the activities that we've conducted? So we'll jump into the meat now. And before we go through all of the components of the plan, namely the priority areas, the 4 priority areas that we landed on, as well as the goals, before we go through, I really just wanted to summarize the core kind of guiding principles as we were drafting the goals. It was really important that all of these goals be based on the data that was collected. We, at the beginning of this project, spent quite a bit of time tracking down different sources and gathering as a robust data foundation as we could. As we continued through this process, we had many great conversations with service providers who said, oh, we have access to this data and you should talk to this person. And we did track down all of those leads as much as possible to ensure that this is based on evidence that is available. And we'll talk a bit more about data further on. We wanted to make sure that anything we recommend would amplify what already exists and really avoid duplication. And we have our little go fish analogy here from Mayor Moffat of, having the municipalities along with the service providers really talking about what they are up to and what they are doing. And, if there are any county-wide initiatives that people are talking and saying, we have this, and someone else says, well, we have that too, and maybe we can work together on that. So that's kind of the reference there. Innovate wherever possible. So looking for creative solutions, not always going to more of the same and trying to do more with less where possible, which municipalities are very used to having to do is be innovative with the funding that they have. Enable and convene key players and work at the intersection of local government, so county and local municipalities, service providers, and community. So really taking on that role of convener. Where capacity and resources do not exist, advocate to secure the support needed. We will probably have more conversations about implementation, but we thought that was really important to call out is, sometimes we have recommendations or goals or initiatives that may require more resources that does not exist. And so in those cases, it'll come down to how do we advocate to get the resources we need to make this happen. And then our last point here is to continuously engage with stakeholders to ensure that progress is being made on goals and priorities and that impacts are effectively reaching community members. So, we originally had 5 design principles, and we brought the most recent version back to the advisory table, and they really felt that this lives and dies by the success of this plan lives and dies by community engagement and making sure that the solutions that are developed are done so with the client, with the beneficiary and citizen in mind. So always just kind of having that component and making sure that they're at the center of the design is going to be critical to the success. All right, I'll pause for a second if anyone has questions. If I don't see your hand, just let me know.
Or, and I'd just amplify, we were very mindful about concerns that I think some of you expressed, but that also people across the system expressed, that the design principles of this thing had to just come up with something that would be a useful addition to what you already had, not a replication, and not a out of norm shopping list that would put, just challenging, but not particularly well-grounded or, demands on a system that was already overtaxed. And so as you can see, the nesting nature of the principles, it really is designed to pay respect to that concern that was first expressed. And we hope you'll see that thinking and concern that you expressed, reflected in the way that this has been built. We were very mindful that for this to be useful, it had to live up to these principles, or otherwise it would just become a series of demand inputs. So we really tried to avoid that, while recognizing that there's some gaps in service, but it's supposed to identify those things, but it wasn't designed to create a pistol pointed at your head.
Thanks, John. All right, so I'm sure that you all have questions, comments. When we circulated the draft, we had just provided these kind of 3 broad questions that you all could think about, and we could kind of pause as we go through these and make sure that you're all comfortable and feel that you have the context for all of our priorities and recommendations. Here is our plan on a page. We really wanted to get all of our priority areas and their respective goals on one page, along with the items that have been identified as critical enablers to the plan's success, as well as some of the factors that may pose barriers to the plan being successfully implemented. The overlapping circles of each priority are meant to show that these areas are all interconnected. That was another point that really rang through while we were doing this work, is someone who is experiencing housing and homelessness challenges may also, or likely is also, dealing with issues surrounding poverty and employment, and some may also be trying to navigate the mental health or substance use supports in the community, as well as associated medical conditions. So that was also kept in mind throughout this, that one issue can be compounded by another, and none of these things exist in isolation. Another thing I wanted to draw out on this page is it's around, again, implementation. It's not expected that the implementation of all these 12 goals will begin on day 1. It is important to think of the full plan document as a first step or the foundation for further action and more detailed implementation planning to take place at the subcommittee level. That being said, you will have seen in the report that we did lay out some very specific actions and activities that could be done at a subcommittee level, and actually time them out. But again, those are still a first couple steps, and additional planning will need to take place in order for this to work. And we'll talk a bit more about that supportive infrastructure and committee structure towards the end. All right, so we're going to dive into the priorities and goals. And we'll begin with housing and homelessness, which I think Mayor Moffat and Mike would agree, Mr. Rudder would agree that really emerged as one of the strongest and most problematic issues in the county. I think it's the thing we heard about the most through the survey, through all of the service providers, and it just was a very clear theme. So our findings showed us that the county's housing context is characterized by a lack of available housing across the continuum, and it actually impacts community members regardless of income levels, right? I mean, the most wealthy are perhaps not suffering, but it is not only those who have the lowest income who are affected. There is what's called a missing middle when it comes to housing. And in response to this, the advisory table has put forth the following goals. First one being align policy priorities and activities across programs and initiatives to the 2020-2029 City of Kawartha Lakes and the County of Haliburton Housing and Homelessness Plan. And this is one of those areas where we amplify what's already being done. Our advisory table pointed out to us that there are a lot of really important and worthy pursuits and goals in this 2020-2029 plan. And instead of splitting resources, that it should be a double down situation and really starting to work with this group and the relevant service providers to start off by defining outcomes. Goal 2, we have develop wraparound support for community members struggling to access housing through greater service integration, communications, and outreach. And so the strategies associated with this goal are all based around collaborating with service recipients as well as service providers to evaluate and assess the service gaps. So we know that there are we broadly know that there are gaps, but really going through and understanding where those gaps are, and then beginning to plan an approach to program, service, and initiative co-design and implementation of a closed loop referral system, which is really just this idea of once a referral to a provider is made and that provider also makes an additional referral, that there is communication between the two service providers and effectively closing the loop to make sure that service is delivered, which helps with measurement, which helps with a continuity of care and service. And so that was something that we were hearing from the group. The last goal under this priority area is continue to support provider collaboration and information sharing to improve wraparound services, system navigation, and greater recipient autonomy and agency. So strategies and activities like developing a housing website that builds on existing platforms or sites to centralize information. This sounds somewhat basic, but there was overwhelmingly a sense that there's all of these different services and resources, and it's really hard to understand where to access them. So just the centralized, like a basic first step of centralization of information was something that people were interested in seeing come out of this. So I will pause here at the end of the housing and homelessness strategy. Lots of information, but under the assumption that some of you had a chance to review the document, if there are any questions or comments, I'd be happy to address. All righty. Okay, moving into the poverty and employment priority, we found that the county's poverty profile is characterized by low income, minimum wage jobs, which results in high Ontario Works enrollment, and this is even amongst those who are employed, right? So it's people who are working but are not reaching that threshold, so they still need the support of financial aid benefits. This is then, as I mentioned before, the connection to housing. We were seeing and hearing that poverty and employment issues are exacerbated by housing, as well as significant limitations in mental health and addictions and substance use outreach support and services. So this is really one where we saw and heard about the compounding nature of some of the service gaps. In response to the findings, the advisory table set out the following goals: to reduce existing barriers to access and advocate for improved employment opportunities for low-income groups. And the strategies here are really based on collaboration with educators and employers to develop targeted action plans and initiatives to improve employment opportunities for low-income groups. And so really, again, just starting the conversation with the key stakeholders involved and mobilizing around some tangible initiatives, awareness campaigns, and things like that to mobilize. The next one is to elevate. Warden Danielson, did you have a question?
No.
Okay, sorry, I just saw your mic go off. The next point is to elevate existing service integration and information sharing to alleviate poverty across areas such as housing, transit, and food. So there is already a lot of really good work underway here. So this would involve amplifying existing poverty reduction efforts. So similar to the housing strategy from the city of Kawartha Lakes and the county, there is the county's poverty reduction roundtable and the city of Kawartha Lakes and county poverty reduction strategy. And so again, not starting from square one, but looking at what these outcomes are in these existing strategies and maybe taking a fresh look at what needs to be done to reach those goals, working with the groups who wrote the strategies and offer help. I will just move to the last goal and then we can pause again unless anyone has a question now. Okay, so goal 6 is to identify innovative opportunities to address food insecurity through, again, the closed loop referral process by embedding food security requirements into existing local policies. So official plans and zoning, for example, have an effect on where a grocery store or farmer's market or community garden, things like that might be built. So kind of having that lens and looking at places where a food security policy could be integrated into things that are already taking place, because we did hear and they're hearing that that people are finding it difficult to buy groceries, and they're finding it difficult to make sure that they have food on the table every night. So that's worrisome and something that can be addressed. There's also a lot of really good work recognized through this. FoodNet is a website that actually does what we're suggesting be done for the housing and homelessness piece. It's a kind of a hub of all of the different Haliburton County food banks and services that those who are in need can access. So again, amplifying that work, maybe replicating and scaling it or in other areas where it makes sense. Okay, so that was the last one for poverty and employment. Can pause here or we can just keep going.
And again, I think the important thing to note is, one could be critical of this because it's respectful of, the municipal scope of service and fiscal capacity, because it doesn't take on more. But that really wouldn't have been prudent because we think it makes more sense to respect the municipal scope of service and fiscal capacity. So you see here a real focus on making the best use of what you have, identifying gaps, trying to break down silos, advocacy to fill in those gaps, but no unfulfillable commitments from the point of view of 5-year programs to end poverty in Haliburton. So, I suppose the weakness of it is how unambitious it is in that sense. The strength of it is how pragmatic it is. And, it's not to say that this can't be the foundation for further things down the road, but we were very mindful that the credibility of the process and the times that we were in really put a focus on the optimization and gap identification. And then in the second round of this, there'll be a greater opportunity for there to be, municipal leadership in identifying, through proper municipal governance channels, where you wish to expand, if you wish to expand, and at the time of your choosing. So we were really trying to respect, what this can do to add to your information base without in any way jumping normal protocols around municipal governance or, the appropriate allocation of roles between the provincial government and municipal government. So I just wanted, it may be self-evident from the words that are on the page, but we just wanted to amplify the thinking that went behind it. And the fact that you've got the support of the stakeholder group who understood both what this says and what it doesn't say. So to the degree that there was a concern that this was just going to lead to a huge increase in demand, I think it's been a very disciplined process that way.
All right. Thanks, John. So mental health and substance use and addiction support services in the county, we found are significantly constrained due to the proximity of service centers. It's geographically a large county, and there's also limitations in available resources to actually provide the services that are needed, as well as the ongoing outreach that's often needed in these cases. In response to this, goal 7 we have here is to increase access and awareness of mental health and addiction support services. So again, people don't know necessarily what's out there. And so people who are looking for these services sort of feel like they're at a loss. They don't necessarily know how to navigate the system. And so just making this information more easily available in some way is something that came up multiple times. Also looking towards innovative models to expanding service availability, looking to address the health and human resources crisis. We know across Ontario that there's a lot of staffing issues, and especially after COVID with health human resources. And additional focus on populations that are already underserved. Goal 8 here is to develop an experience-based mental health and addiction, substance use, and support sort of services plan and set of programs by working with community members with lived experience. It's not always clear that the services available today are necessarily connecting with the people who need them, and so making sure that people can see themselves in those services is critical. The services that are available are fantastic. It's just a matter of making sure that there's a connection to the people that they serve, both physically and emotionally. So our last piece here is information sharing on substance use and addiction, harm reduction, and mental health. So leveraging existing strategies. So we know that there's the Haliburton, Kawartha Lakes, Northumberland, and then the Haliburton, Kawartha, Pine Ridge drug strategy pillars. And so really just making sure that those are again being looked at and elevated and used as a framework for work going forward, potentially revised if need be based on new context. But yeah, that's the overall gist there. Our final priority is healthcare system access, and we found that different demographic groups face unique challenges in accessing health. However, there are inequities experienced across priority groups as well. And so we had a goal here to increase awareness on the importance of physical movement and increasing access to active transportation as a central mode of mobility. So not always a ton of active mobility infrastructure, sidewalks, making things more walkable, and spaces for activities and things like that. It's something that could be built out across the county. Develop a health equity working group to support equal access to health across priority groups such as low income, BIPOC, and LGBTQ+, as well as seniors, which will begin with convening a health and medical care providers group, as well as social service providers to, again, drill down on the key gaps and intervention strategies that are needed here, among other actions and strategies. And then our final goal is to enhance and expand the service scope of virtual care. So we've seen a lot of virtual care models and platforms come up through the pandemic, especially kind of leveraging that momentum and using it to benefit the county and its kind of geographic distribution, allowing more people to access mental health or other health services without having to travel, which, transportation is a major key enabler that came out of this. Is you can have as many services as you want, but if people can't access them either from home or by driving there, then they're not going to be much use. So those, the whirlwind tour of all 4 priority areas and the 12 goals. I'll pause again for any reactions, unless it's preferred that I just finish up and then we can stop and talk.
You could probably just finish up and then we'll, I think the thing is that it is a ton of information and it's a lot to digest. So if you finish this part and then we can maybe just have a little go around. I've just jotted down a couple of things and then we can go on to the plan walkthrough.
Absolutely. Okay, so to make sure that we get to sort of the infrastructure piece here, underpinning the implementation of each of these priorities, there are some very critical foundational governance and infrastructural elements, and this would include good governance and the identification of a resource at the county to help spearhead and mobilize the implementation of goals and strategies, and to work closely with the advisory table and the steering committee, as well as any subcommittees that are struck to mobilize this work, and really monitor and track and evaluate progress. We also talked about data earlier, and setting up a group or a data table that stewards the collection and analysis of data, all relevant data to community safety and well-being across the county, and really focus their time on making sure that data collected is up to date is going to be critical for the continued success or an implementation of a plan like this. And then finally, we have continued consultation and engagement. We've done a bunch of engagement through this process, but it will be really important that on a near annual basis, that there's a temperature or pulse check with the community and key stakeholders on what's changing, what needs to be updated. Are any of the goals irrelevant? Are any, very obviously missing? And so making sure that that's kind of a perpetual feedback loop will be important for the success of the plan. So we're going to stop now and discuss the plan here. Anything that is striking you all as something that needs to be adjusted or things like that, we will make those updates. We want to make sure it's reflective of your feedback. And then we will take the final steps to finalizing the plan for public release. But again, we're not rushing that process, where we want to make sure that we're making the changes and applying the feedback that we receive. So that's the presentation. Happy to turn it over to you, Madam Chair, to talk through some of the comments.
Yeah, thank you. Thank you for the presentation. And you're right, it is a bit of a whirlwind tour for what is essentially a much meatier document, but Councillor DeVolen has his hand up, so go ahead.
Well, I mean, a lot of this brings together in one place a number of portfolios that on behalf of the city and the county that have been involved for years. But for me, the elephant in the room, and this is no disrespect to what's being proposed here and how it puts together in governance and all that, the elephant in the room is money. Everything that I see that's talked about here is either things that are not directly under our control, or that we don't fund or have access to fund. So that's the overwhelming thought as we've gone through this whole process. Who's going to pay?
Yeah, and that has been a theme. Everybody at the table working on this is very well aware of that. And I think part of that is a little bit of siloism, as you're on the poverty reduction roundtable, so that can exist. And we have seen in the draft county budget some money for something that I was advocating for and got support. I don't think it was a bit of a no-brainer there, but a navigator, because the success or failure of this complex piece of work will lie in someone to stitch the pieces together, and determining exactly that as one of the main components, because nobody has any money, but everybody has lots of needs. So it's going to have to work together, have someone stitch it together so that the groups, as has been mentioned, I sounded like a bit of a broken record during the meetings, but it can't be the expectation that this agency is going to pay or the county is going to pay. And the sort of joke was, we'll go fish. So we need someone to do a thing around mental health. What do you got? And everybody has to go, well, I have this and I have that. That in itself is like turning the Queen Mary, because it's contrary to how all these agencies have worked with the county or not with the county for years. They work really well together, but it's our plan and we're now in there. And so that remains to be seen. It's my hope that having the plan will help in our ability to advocate to get some of these services, or to get funding, or to get there. And I don't know if the strategy core folks have any more input, but we have certainly talked about who's signing the check for most of this stuff.
Well, and if I could add, Madam Chair, Councillor DeVolen, you're absolutely right. It used in a way that this plan should not be used. Its executive summary could be either pressure the county or other local governments into buying more oranges. There's definitely stuff here that says, do a better job to squeeze more juice out of the oranges you have. And then there's definitely stuff here that is lobby to get the province to give us more oranges. And what we viewed it as, number 2 was good, number 3 was good, but number 1 couldn't be the answer of this, because if all this did was create a demander wish list of stuff to put on the government that's got the least fiscal capacity to pay for it, that really wasn't what it was intended to do. It was intended to optimize what we've got, identify gaps that we could get the government that should pay it to pay for, And if down the road, if there's something that you want to do to fill in a gap because it makes sense to you as the county, then by all means, let it make sense to you as the county. But this couldn't predominantly be a thing to make you have to buy more oranges. But I think most of these actually are about squeezing more juice out of the oranges that you have. And that may only lead like a 3% improvement each year for 3 years. But even that's a 9% improvement. But we didn't think that there'd be a lot of 9% funding increases coming from the county, and we didn't want it to be used that way. So I really respect the question, and I hope the work is a little better than something that can just slump back into what you're concerned about, because if it did, I would view it as a slump.
Are there, Liz, go ahead.
Yeah, it's interesting that Brent would use the term elephant in the room, because all the time that we were listening to Lauren, it was like the elephant in the room. There's so much work to be done. I mean, I can't see any questions or issues with the goals and the strategies that you've laid out. And it's excellent that we're going to be, hiring somebody to sort of stick handle this project, but we still rely on all these other groups and agencies to work with us and assume responsibility for things. And we don't have I'm assuming throughout this project that they've all agreed to work together and see the benefits to having a plan like this. But in reality, are they really going to? I mean, we don't have the ability to say you need to do this. Even in the here's our problem and what do you got? What can you bring to the table? We don't have any real ability to make anybody do anything.
Well, if I can respond,
Yeah.
Madam Mayor, I look again. That question is probably as good as Councillor DeVolen's, because if the one is about where's the money coming from, the second is where is the will to collaborate coming from, and if there's a thing that's optimistic about the community safety and well-being plan methodology, it's that being in silos isn't good enough, and that if you put the person who you're serving in the center and then say, how do we all collectively serve them, then the cool thing about your 4 priority areas is you see the intersectionality of the 4 priority areas. It's not like everybody who's in one is in all 4. But there's plenty who are in 1 who are actually in 3, at least, and maybe 4. And so it's about breaking down those service silos, and the data tool, which is the structural organizational thing, is probably the most powerful tool for doing that. Because if you can't measure something, you can't manage it. And I think the commitment here to have a coordinator lead that's permanent and a table that's permanent, and then data sharing that's permanent, that casts the bright light on the thing that, that was perhaps the other elephant in the room for the last 100 years as we've evolved, that we've evolved all these silos that treated people within the logic of their own silos rather than seeing them as integrated people who needed integrated assistance from an integrated network of service providers. So if there's a reason to believe that goodwill will prevail, it's because data will cast a bright light on it. And I'm not going to sit here and say that we can see inside the hearts of executive directors who haven't been hired yet, who will populate some of these positions over the life of the plan. But I think once you have a commitment to ongoing stewardship around these 4 priorities and 12 or 4 action areas and 12 priorities, and you have data that supports them, I think we can't help but see incremental improvement, because as we start measuring things, we can manage them. And I don't know that each of the entities that participated in this is 100% bought in to the same degree, but I think they all are to some degree. And so I don't think that this is the panacea, because if it were a panacea, it would come with money and dictatorial power to jolly well force people what to do. But system doesn't work that way. It doesn't come with money, and it doesn't come with dictatorial power. So the next best thing is collaboration and data. And so I don't think we can fault the plan for what it isn't. But I think Councillor DeVolen and Warden Danielson, you're absolutely right to point out that it maybe only gets the bronze medal of what it could be, but that's all it was ever destined to be.
Well, right, and the success is in the effort that everybody puts in. Remember, I think that those at the table who helped craft this are skeptically enthusiastic. There was a lot of smiles and there's a lot of hope out there, but it's almost like everyone's looking at each other with the exact same, well, I'm in, but are you? And I'm in, but are they? And that's why it's going to take everybody to just like lay their cards at the table, I don't want to say lay their swords because there's no war, but to encourage that participation, to exactly as John said, build the data set that provides for going forward. Is it going to be easy? Not on your life. Is it an incredible opportunity? Absolutely. I think that's why the navigator is key, is somebody to stitch it all together and make sure that the people remain at the table. But they were all there. The people who need to be at the table were there, and they participated as they needed to. And I don't think any one person on behalf of any group or agency was there grudgingly. I think everybody was there with hope. And again, it will be the good graces and the goodwill of those bodies and persons who will see this move forward. If in the end it doesn't work, it will be in some systematic failure in there somewhere. But again, that's the navigator's a vital role to have this make or break the success of this. And I appreciate that it sounds a little bit Pollyanna, but it's what we have. It's what we've crafted, and we can do it. We can be the little train that could, but we have to believe in it. That's my little speech for today. Other questions, comments? It is a huge body of work. I see some sarcastic smiles on the screen, but I know that's not intentional. Councillor Roberts, welcome. Congratulations and welcome.
Well, thank you. Who knew that could happen in a blink of an eye? So apologies for being late, but I got a jab in the other arm. So I think too, I don't know if it's already come up, so apologies, but in terms of how we measure success, and I think of our climate change plan, and it's hard for us to measure success with that because the climate is continually changing. The temperatures are getting milder. The storms, as we know on Saturday night, are getting wilder. It doesn't mean we don't do anything. And in this, the climate of our society and the pressures of lack of housing and poverty and mental health may grow. So a bit of a cautionary is like, we don't measure success because in 2 years, everybody's happy and everybody has a house or a roof over their head. We're going into, this is just the beginning, I think, of very, very, very challenging times that we live in. And so we go forward with a plan. We work together as best we can. I don't know what the comments were about a bronze plan, not a gold or platinum one. But anyway, I think measuring success should be that we're still trying, we're communicating, and we are partnering with these agencies of where we live, because things could go where they are now, but they could get worse. And it doesn't mean that we're not still trying. Does that make sense?
Yeah, it does. Yeah, absolutely. Yeah, and I think that's a good summation. We can say this is a nice plan, isn't it pretty, and we can put it on a shelf, or we can commit to continually recalibrating it to meet the community's needs, because as we know, we've been saying for 18 or 19 months now that the community is changing very quickly. It's up to us to keep it alive and keep it what it needs to be. But John, I think you're going to say something there.
I was just going to clarify because Councillor Roberts came in late. Councillor DeVolen had asked a really good question. Isn't this all contingent upon money? And then Warden Danielson said, and the willingness of people to comply. And I said, well, perhaps the gold standard would be a plan that came with all kinds of provincial money for free, as well as dictatorial powers to force people to comply. A silver would be one that came with either of those two things, but not both. And what we've got is a plan that's got shared goodwill and data that at least helps people move forward. So it might be that it's a weaker thing, but nobody was offering the other two. So this is what we got.
Councillor Burton.
Thanks, Carol. I think it probably through to John. I had asked, I think before about the Bancroft plan. And I wondered if you had looked at it and if we're running, I think I used the word before, parallel, or if we can compare the two. And I wonder how they're making it with the elephant in the room.
Yeah, at the time that we were drafting this version, Bancroft was still in the process of updating they had one from 2016, I believe. They were one of the first municipalities to do it in sort of a pilot situation. So we had taken a look at that as an input originally, but I know that they're doing, they've done an updated one as a broader part of the county. And so we haven't found that yet. It might be out at this point. We'd be happy to review and take a look and see if there are any relevant learnings and connect with you, Councillor Burton, on that.
And Matt, you may just want to add in, because the first Bancroft Mark 1 was one of the earliest ones, and it was kind of influential in shaping the whole system. You just may want to comment on that.
Yeah, no, I would have added only to what Lauren said, is that they were, the last we checked, they were in that process. And I think they had a little bit of a, I would say leadership change, but I think they brought a different person in as well to carry on the work. So they've built on it. I think the term evergreen and the continuous improvement of the plan is a really good point that was made earlier as well, because that's what Bancroft is doing. And they were, as Lauren said, one of the first to come out with a plan. And they were assisted by Dr. Hugh Russell, who lives in that area and was very much a part of helping shape the provincial government's framework for the community safety and well-being planning. And I think that's why they were able to get a good foot out the door in the beginning. But we don't have any more information right now as far as where they are in their next iteration.
Are there any other questions at this juncture? There's the entire, or Lauren, is it your intent to take us through the entire plan?
No, so what my offer was going to be is I really wanted to focus on the priorities and goals, because that's the meat of the plan. A lot of the data and kind of description and context has already been covered. We initially went through that in our first meeting. However, it is really important to us that you all feel that it is reflective and characterized properly. And so we would be happy to book one-on-ones with each of you, just to make sure, if you have any additional comments, to make sure that we're gathering that. Again, if there's anything that jumped out to you that you want to discuss today, happy to go through it. But I didn't think that it would be the most productive use of time to scroll through the full almost 50-page document. But door to feedback is always open.
What's your what's the time for your anticipated timeline for moving this through to presentation to the public? Is it upon approval of this group today or some other day, or what if you have no feedback other than what we've talked about so far? What's next?
I believe, Mike, did you want it to go to council?
Yeah, I think that was the intent, to once this group had its thumbprint on it, then we would move it to council. We hadn't really set a date for that. We were hoping January, but if there was any significant feedback received, it might be difficult to hit that target. But our goal was to be at council in January, and then if approved at that point or adopted at that point, it would go to the public at large.
Councillor Dolan.
Yeah, barring some small tinkering suggestions that are made with elements that are in, like you say, a 50-page document. I mean, I'm prepared to go. There's been a lot of time and a lot of thought put into this. I don't have a problem in the form that it's as it is to go to council for subsequent, to have approves and approve, and then into showing in the public. There's going to be some little tweaks and metamorphoses along the way, but in general tone and what's there, I'm from where I sit today, I'm prepared to move forward with first presenting it to council as quickly as we can in the future, and then move on to the public. There will be input from various quarters that will change it somewhat, but as a body of work, I'm prepared to move on.
Thank you for that. And I wonder, where are we with the other advisory table members and their view of this? So yes, it's a county plan, but it requires the participation of those groups, all of whom have willingly, joined that table. And where are we with their review of this? Or are we?
Yeah, we are we're at the end of review cycles. Unless there was anything major that came out of this meeting that we needed to then take back to that group and update them on. But they, as you're aware, had several review cycles. We had a number of one-on-one meetings with each of them as needed. We kind of sent out a final call and saying this is going to steering committee, and we got a lot of great last kind of minute feedback and made some adjustments before sharing the draft with you. So they are comfortable with where it is at.
Okay, so we're the end, not partway through for the review process. Well, that's fine. Matt, please go ahead.
Just want to make sure I say this before we close, and I just want to maybe reiterate and build on something that John said as well in response to the elephant in the room on the dollar side, and just give you the perspective of where we were in government when these were developed. A couple of statements come to mind. One from the Canadian Mental Health Association and their principles of nothing about us without us, and from AMO, which we heard many times, say for pay, and the principle behind this. And this might help, especially if you get these comments in the public setting when the plan gets presented publicly, is that it strengthens, or it ought to strengthen, a municipality's place when making public policy decisions, because it really does shed clarity on who has funding responsibility for what. So in this plan, and I think everyone's done just a fabulous job in pulling it together, you end up in a place where you can say, no, we've coordinated, we have our yard well organized, cleaned up, and operating at full function. So if there is an area that is falling short, it's the responsibility of X. So it really differentiates level of funding responsibility based on level of government. And I think it lends itself to that evidence-based policy development that the municipalities, based on all sorts of, whatever you want to say in the past, have not been in a really strong position. And I think this strengthens the position that you're in as a municipality. So if you ever get pushback from those that are saying, well, yeah, this is all fine and dandy, and where's the money? Well, we're coordinating. We've got the sharing and the advocating and the coordinating, et cetera. And I think I think it's a great plan in that regard as well.
That's great. Thank you for that clarification. Warden Liz.
I'm just thinking that this is going to take a rather extraordinary individual to help us work with and coordinate this plan. And I'm really wondering, what the primary skills of this individual need to be.
Oh, that's a great question. I actually think they need to be one part policy wonk and one part lobbyist. I say policy wonk because they've got to love policy and breaking down barriers between service delivery models, and one part lobbyist because they've got to be really good at communicating in a non-threatening way why people ought to come together and collaborate, instead of accidentally triggering people's defenses about why historically they have not wished to collaborate. And I think the main tool they'll have is the residue of goodwill and optimism that Councillor Moffat was talking about, or Mayor Moffat I was talking about. But there'll be all the anxiety that Councillor DeRolin and you were talking about, Gordon, about how to actually come across with progress if there's no resources or the others. So I think ideally a person who starts with pre-existing relationships. So they would not want to be meeting people on their first 6 months on the job, but rather recruiting somebody who knows these people and who truly buys into the kind of symmetrical logic of the thing. And then I think maybe the one other attribute is, data sharing. It's one part overcoming the anxieties of privacy lawyers. It's one part coming up with kind of technical gearhead stuff about how we're going to share it together. And it's one part will. And so they're going to need to be resourced with sufficient legal and gearhead tools that they can focus on the will. Because I don't think you'll find anybody who's got law, IT gearhead, plus policy wonk, plus advocacy. So I would say rent, law, and gearhead, but be a policy wonk who's really passionate about making this thing happen. And if they totally see the person who they serve as being in the center, and they're just kind of relentless, it's at positively seeking opportunities for collaboration and identifying gaps, I think you'll have a really good 4 years. And we won't be talking about what they didn't do. We'll be talking about, isn't it cool that we're squeezing more juice out of the oranges that we have? And it's putting us in a stronger position when we go to the province to say, because we've done such a better job, like Matt was saying, about using the resources that we have, that we're in a really good position to articulate why, having helped ourselves, the government should now be helping us. So, but I think your question is a really wise one about who you're going to get, because if you get the wrong person and they're kind of overtasked by the job, it won't be as fun for anyone.
So that brings the next elephant in the room is who writes a job description, because that's going to have to be very carefully crafted and so that we can get the right person that seems to have to wear many hats. Is that, I think I'll go over to Mr. Rutter for that.
I guess
Sorry.
it would be us that would draft it. We would, I think, take the information we've seen today. I think the advisory table we would kind of check their temperature on what that kind of skill set would be, what should be in the job description. Ultimately, it would be approved by council before any recruitment is done. But yeah, I would say we would start almost immediately crafting a document and then begin a review that way, with checking in with the advisory table and then bringing it to county council for adoption.
Councillor Roberts.
Do you want to finish what you were going to say before I speak?
I was heading towards wrap up.
Just lastly, I've been thinking about this and the job, and this might draft up a job description, but I also think there is, and we know there are so many talented people living in our community. It could be somebody who's newly retired. It could be somebody who's looking to do something. I mean, look at our physician recruitment previous person who was extremely talented, right person for the job, and has set the stage for the next person doing that. So I bet there's somebody out there in Haliburton County that knows, as John just described, those connections are already partly there, that I think we'll find somebody. I'm quite confident we will.
I agree. And you can have the tools for the job and not know the people, but you can be introduced to the people. But if you know the people but don't have the tools for the job, that's a whole different, that's what we don't need. So there could be somebody who is, newly full-time or newly retired, exactly as you mentioned, who may not have all the ready networks, but those people can be introduced. So I think that's fair comment. So what I'm hearing is this group is willing to move this forward to county council and just continue on with next steps. Is that, would everybody say nod, nod, nod? That's what we're hearing? Yeah. So thank you for the step-by-step explanation. As mentioned, it is a big body of work. It's complex, also maybe a little bit complicated, but I have hope that we'll get there. Incremental, piece by piece. And I don't know if you guys want to say anything, if anybody from Strategy Core wants to wrap up. If not, I'll look for a mover and a seconder to receive the plan, draft plan, but any wrap up from Strategy Core? then I would look for what's your resolution there, Mr. Rutter? Is it to receive?
Well, actually, we've said that be it resolved that Halliburton County Community Safety and Wellbeing Plan Steering Committee received the draft final County of Halliburton Community Safety and Wellbeing Plan. That suggested changes be incorporated into a final draft that will be presented to County Council for adoption in early 2022.
Oh, that sounds lovely. Who would like to move and second that? Councilors DeVolen and Burton. And you've heard that resolution. All in favor? That is carried. Terrific. And just before we adjourn, just thanks to John and gang for all the work you've put in. It's been quite a process, and I think John had said it as I did in the beginning. In the beginning, I was, a bit grumpy about it and thought, this is a terrible idea and I don't want to do it. We're being forced into it. And my colleagues will remember our letter from the CPAC committee objecting to it. But as the process has unfolded, it's the opportunity is there. So thank you for everything you've brought to the table on it. And we'll see where we go. We're not done, but we'll see how we go from here. Now, will you guys present to County Council, or will County Council just have their own conversation? How does that work? Anybody?
The quick answer is however you like.
Mr. Rutter, what are your thoughts on that?
I would think it would be great to have Strategy Corp there, maybe work through a similar process. Remember that the other members of County Council haven't been through the steering committee meetings, so maybe a little more background, but certainly present the final document similar to today.
Okay, so we'll leave that for you guys to sort out what date works in the new year. And to that end, I will again say thanks to Strategy Corps for bringing this forward for us, and look for a mover and a seconder to adjourn today's meeting. Councillor Roberts and Warden Danielson.
Moved by Councillor Roberts, seconded by Warden Danielson. Be it resolved that the Halliburton County Community Safety and Wellbeing Plan Steering Committee now adjourn.
All in favor? That is carried. Thank you, everybody. This is, I think, for many of us, this is almost the last meeting for the year. And so happy holidays, Merry Christmas. Everybody be safe, warm, and peaceful. Thanks very much.